Prematurity is a recognized major cause of M&M among twin gestations. Adequate weight gain in the first 20 to 24 weeks of pregnancy is especially important for women carrying multiples and may help to reduce the risk of preterm and low birth weight babies. Elevated alpha-fetoprotein may indicate twin gestation. It should roughly be twice that of a singleton pregnancy. An additional clue to a possible diagnosis of twin gestation is fundal height exceeding gestational age in weeks. Twin-twin transfusion syndrome is the result of an intrauterine blood transfusion from one twin to the other. It occurs in monochorionic monozygotic twins. Although monozygotic twins can have dichorionic placentation, such twins are not at risk. Monozygotic twins with monochorionic diamniotic placentation or monochorionic monoamniotic placentation are at risk. The donor twin is often smaller and anemic at birth. The recipient twin is usually larger and plethoric at birth. Clues to the presence of the twin-twin transfusion syndrome include large weight discordance, polyhydramnios around the larger recipient twin, and oligohydramnios around the smaller pump twin. The two different placental types in twin gestation are monochorionic and dichorionic. Monozygotic conceptions may have either monochorionic or dichorionic placentation, depending upon the time of division of the zygote. Dizygotic conceptions always have dichorionic placentas. Diamniotic dichorionic placentation occurs with division prior to the morial state, which is within 3 days post-fertilization. Diamniotic monochorionic placentation occurs with division between days 4 and 8 post-fertilization. Monoamniotic monochorionic placentation occurs with division between days 8 and 12 post-fertilization. Division on or after day 13 results in conjoined twins. Acardiac twinning represents a syndrome characterized by vascular anastomoses in combination with partial or complete lack of cardiac development in one of the twins. Superfecundation is the fertilization of two or more ova from the same cycle by sperm from separate acts of sexual intercourse. Preterm birth occurs in over 50% of twin pregnancies, 90% of triplet pregnancies, and almost all quadruplet pregnancies. In multiple gestation, prematurity has the most significant consequences as it is associated with an increased risk of respiratory distress, intracranial hemorrhage, cerebral palsy, blindness, and low birth weight. IUGR, intrauterine death of one or more fetuses, miscarriage, and congenital anomalies are all more common with multiple gestation, as are the complications of preeclampsia, diabetes, and placental abnormalities. The twin infant death rate is 5 times higher than that of singletons. Multiple gestations have reached epidemic levels due to assisted reproductive techniques. The risk for development of cerebral palsy in twin infants is 5 to 6 times higher than that of singletons. In a study comparing dichorionic twins, monochorionic twins, and singletons, showed that twins had a higher incidence of intrauterine growth restriction in comparison to the singletons. 58% of twins deliver prematurely with an average gestational age of delivery of 35 weeks. 12% of twins may deliver very prematurely. Ultrasound markers suggestive of dizygotic or non-identical twins, fraternal, includes a dividing membrane thickness greater than 2 millimeters, a twin peak lambda sign, different fetal genders, and 2 separate placentas, anterior and posterior. The 2 different placental types in twin gestation are monochorionic and dichorionic. Dizygotic conceptions always have dichorionic placentas. Monozygotic conceptions may have either monochorionic or dichorionic placentation, depending upon the time of division of the zygote. Diamniotic dichorionic placentation occurs with division prior to the morial state, which is within 3 days post-fertilization. Diamniotic monochorionic placentation occurs with division between days 4 and 8 post-fertilization. Monoamniotic monochorionic placentation occurs with division between days 8 and 12 post-fertilization. Division at or after day 13 results in conjoined twins. The ultrasound markers for determination of chronicity described above have been used to assess risk for complications of pregnancy, most notably the twin-twin transfusion syndrome.